Thanks. Hi, everybody. So I'm Jenny Wood. I'm here. I've worked for the strategy unit, but I'm here representing some work that we did with Newcastle City Council on making business intelligence illuminate and not intimidate. And unlike many of the presentations you've seen today, this is very much more on the kind of BI side of things. Like, you know, Peter spoke this morning about there being lots of different types of analytics, and it was important to draw out BI as different stream and different focus to analytical products and research. And I think that that is a really important thing. But I also think that there's a really important role for good quality VI when it helps with organisations understanding themselves well. And there are a lot of difficulties with how to do that well. And I think that we had a really good progress in Newcastle from what I would describe as a really not a great relationship with data originally. And my ex-colleague, who's principal social worker at Newcastle, said, who was going to come down, and then operational reasons meant that she hasn't been able to be here today. And she said, you're going to be polite about how it was before, right? And I was like, yeah, but this is how it felt. You know, I think that many of us who deal with KPIs or RAG ratings or that kind of way of managing services know how destructive that can be potentially to creativity or to how you manage a business. And this isn't necessarily because any one person wants to manage an organisation like this. If you come on our systems training, I've heard Mohammed talk recently about some of these things. Recently, I heard Toby Lowe say performance targets create a discipline and punish mindset. It's not an accident that it ends up shouty like that. It's almost how it has to happen. That's how it's designed. If you've got a stable system here, they said, there's no use in, if you've got a stable system, there's no use in setting a goal. You'll get whatever the system's made to deliver. If you don't have a stable system, then you may as well not set the goal in the first place, is what Mohammed taught me. This is from the Monroe Review of Children's Social Care, and it describes how increased prescription, increased measurement, increased KPIs actually makes social care worse, makes social workers worse at what they do, because it takes functions away from them, it takes choice away, it takes time away, and makes that work a lot worse. And there's some interesting things about how intrinsic motivation works. Most people who work in health or social care are intrinsically motivated. We're not all in it for the big bucks, despite how wonderful we all look today. We're in it because we really love what we do and because we want to make a difference. And this book recently has been talking about intrinsic motivation and value-led cooperation being the things that make a difference in terms of change. But we still have these performance targets. And so if you spoke to some types of academics and some social workers, they say, we'll cut the data out altogether. And in a room of analysts, that's going to be a bit of a tough call, and I don't agree with that. And there's some quite obvious reasons why. We're accountable for money in the public purse. We've got to give assurance to these organisations who structure themselves and who make decisions about strategy all of the time. And we've got regulators for good reason, because awful things happen when organisations get things wrong. And we do need to, whilst not everything is preventable, we need to have some idea of how well the system is functioning at doing what it set out to do in the first place. So what we did at Newcastle was talk about changing the model. We had a new associate director coming in for children's social care. She wanted to say, I share your values. Children come first for me as well as they do for you. Social workers need to know that I'm not about rag rating. I'm about making sure that children are safe. I'm in here. We share the same values. We won't use data as a stick, which is what people used to tell us. It feels like a stick that you beat us with all the time. Use the data to describe and improve the system, not to manage individual performance. We decided to use different types of data being influenced by research methods to try and give a fuller picture of what was going on instead of this kind of very limited KPI perspective. And could we aim to try and co-produce narratives of how the system was working, using staff and service users instead of a kind of top-down view from a set of KPIs? So that was the ambition. And so we started with, any of you who've been an analyst in an organisation, you can go into a room of people and be like, I have found the most exciting thing, you're going to love this. And they get fixated on a tiny anomaly on the first page. And you spend the whole meeting talking about whether the data's right or not because of one slight data quality issue. So that was something that we tried to really move away from. So could we make the source of the information that's being provided to social workers on the front line, their lists of activities that we're doing, the same as the information that's going to managers, the same as the information that's going to statutory returns, the same as the information that's going to Ofsted. Can you make dashboards, drill down reports, self-service information that means that we can always drill down to that level of information? So everyone can see where that's coming from, and when they see some data that they don't understand, they can get to the bottom of it, they can find that child. If they don't think it's right, they can look that up and we can have a conversation about it. And really importantly, as part of that process, the analysts involved in this need to learn the processes which generate the data, go and work alongside people, see what happens, know that if we don't have an address for this person, we always put it as the office on that street over there, and so you don't end up with a really weird anomaly over here. Or, you know, there's a load of things that happen through the processes which you could spend ages on, could seem really interesting when you're doing analysis. Actually get really close to it, get close to the people, understand what those processes look like and what and get that relationship going, and everything seems an awful lot better. So that was really successful. It worked quite well. As always with dashboards, there's always something else to do, and you're always a few iterations off where you want to be. But that felt like a good thing, and it also drove a lot of cleaner data for statutory returns and clear information for Ofsted. So it kind of saved us a bit of time later down the line to make that right here. The next thing was performance and practice conversations. So instead of having top-down KPI stuff, yeah, we still use the indicators, but it wasn't just about that. Can we break them out into are children safe and how's the system working? Can we have them as collaborative and curious conversations which say, why is this happening? What do you think is going on here? What could be driving this? How are people feeling? And then specifically drawing out something a bit different. What are we noticing? It's not all about KPIs. Can you tell me something that you think is happening in your area of the business that we could follow up? Now, this is the bit that Peter says gets squeezed when you're trying to mix up analytics and business intelligence, and he's 100% right, and I've still got a load of hypotheses that I would love to follow up in this space. But it is useful to have those conversations, and even if you don't get to every analytical project, you're getting a better understanding and people are getting an opportunity to co-produce the narrative about how are we doing, what's going on here. And again, analysts are in the room, building a relationship with the operation, helping that, making sure that that's a dialogue, everyone's understanding what's going on. And then practice week, which is where my colleague Lisa was going to speak. This kind of comes from the audit world, and it's a way of trying to link what would be qualitative research methods really in a university environment, and often in local authorities you have like our QA work over here, which is a long way off. What can we do to draw that together with the analysis that we've got? So home visits. So we had one week a quarter. Every meeting is cancelled in children's social care. Everyone from directors to social workers spends that week really working on quality and understanding what's going on in the business. You've got observations, home visits, meetings, reviews. People are going out to children's homes. People are going all over the place. And that's a kind of ethnography view, like from a research perspective, you're kind of seeing how things are going on. So the director of children's social care has been down in a children's home, is seeing what happens in a visit, and has a real understanding that you just can't get from any, the smell of the baby's head, people talk about, things like this, that are real experiential knowledge that's really difficult to get from boardroom conversations. Audits happening, but face-to-face, file reads, and linked to a theme, loads of them going on through the week, so we're doing a kind of thematic analysis of that work at the same time. Feedback being sought, both through surveys and feedback tools sent out to every child and young person, but also face-to-face conversations and observations happening. So you're really trying to bring the experience of the clients, the children, users into the room. Building in some learning and external training, more of that at the beginning of the year when there's slightly more money, none of that at the end of the year when we're all just doing it internally. But, so what else, what are we hearing from other people? What can we learn? What needs to come into the practice? Great, thanks. And then not to lose that statistical view or the analytical or the numerical view. So we're always trying to do some work on data warehousing, or finding out what we can, finding out what we know about the housing system, or finding out what we know about drugs and alcohol. So what can we do about bringing or following up some of the hypotheses that people might have had in performance and practice conversations? So what we would normally do is take a lot of graphs and charts and put them up as if it was a primary school teacher display in the offices in social care, and try to talk to people about what the data means. So when you're recording this, it tells us this. What are you noticing? What are you finding out? So trying to get that constant mixed methods and triangulation. And it sounds like it's a huge amount of work, and it is a lot of work for the organising, but it's done by, it takes a good amount of time for one person and 1.5 person to do once a quarter. But the value in terms of the how much people learn about how the organisation functions and how much more they get out of it than really long, formal presentations of data, I think it's been very, very successful. And Ofsted came in and said, yeah, we really, really like this. You know your business really well. You've got people's views being included in a really interesting way, and it's really helping inform practice. I can't promise that any of this means that permanently children were a lot safer. I think that it's really difficult to make that link to permanent outcomes. And I think in a local authority context, anything that's happened over the last few years is being challenged by the changes in the financial situation and the pressures that are being experienced across society. So, you know, it's not that this is a local authority which isn't experiencing its challenges, as most authorities are in delivering safe social care to children. But I think that in terms of being able to share values about, yes, we put children first, and allowing collaborative work to happen, and the business and how the system's functioning to be understood, it was a successful model. So yeah, 3 elements to summarise with. We had the dashboards and transparent data bit, right? We had the performance and practice conversations, and then that kind of multifaceted practice week going on. And I'd say my key lessons learned were, it's all about values and trust. It's really difficult when you start as an analyst, I think, especially in things like social care, where values are so important. You've kind of got to demonstrate that you share those values through reflecting language back, through understanding and expressing jargon in the right way. And that's not, it's not faking it, it's demonstrating that, but you're existing in a culture that isn't an analytical culture. You're existing in a social care or care culture. It's important to that collaboration works because you share values and trust. Claire was talking earlier about curiosity. Curiosity is so important. Asking, how's the system not working, not why are you not performing in the way that I want you to. And Mohammed's work on variation, again, in that systems training I was talking about earlier, is really helpful in that perspective. Try and move past data quality and that, oh, everything would be better if that team over there were doing something different. Let's keep it. Trying to get people to the point where they can really reflect on what they're doing to make a difference. Communication, uncaging your analysts to a large extent, or in some instances, kicking them out of the office and making them go to other places, even if they want to look at a spreadsheet all day, I think is really helpful. And thinking about mixed methodology, data is not just KPIs. Thank you.
Very much, Jen. We've got probably time for one question whilst we do the transfer to the next speaker. Anybody got a question for Jen? I was loving uncaged analyst, but for practice week, just really, as a, you know, very long time ago, being a general manager in a hospital, I could. Gosh, yeah, I love the idea of that, cancelling all those meetings. Yeah.
And also, I mean, I think practice week isn't entirely in Newcastle. We didn't make it up entirely. Like, there's nothing new under the sun, is there? But I think that it's